My name is Ramona Rajapakse. I am an attending gastroenterologist at Mather Gastroenterology. I deal with almost every general GI problem, but my subspecialty is inflammatory bowel disease. IBD is, as the name implies, inflammation of the bowel. Typically, when we say IBD, we're referring to Crohn's disease or ulcerative colitis. In terms of diagnosis of inflammatory bowel disease, there isn't a single diagnostic test. We rely on a combination of clinical symptoms, EGDs, and colonoscopies in order to be able to make the diagnosis. Irritable bowel syndrome, also called IBS, is a problem with the motility of the GI tract. Sometimes the gut is too sensitive and contracts fast, and sometimes it's a little sluggish and contracts slowly. What is very different in IBS compared to IBD is that in irritable bowel syndrome, there's no inflammation. So when you look in, it all looks normal. The diagnosis is usually made after a careful history and ruling out other things. There are a few different treatment options for IBS, but first-line therapy is really conservative management. We use diet. A diet high in fiber is important, calming it down, preventing flares. In terms of inflammatory bowel disease, it's a whole different ballgame, really. We use very specific anti-inflammatory drugs. And more recently, we have what we call biologics. We have a variety of these biologic agents now available for treatment of both Crohn's disease and ulcerative colitis. I think the local community is very fortunate to have a hospital like Mather, which is a community hospital. And I, for one, really enjoy the collaboration. We do have, a multi-specialty groups here. We do have world-class physicians at Mather, and I think this is something the community should be proud of.